In this video, we provide an overview of a caregiver's role in their child's therapy at Lehigh University Autism Services. It is well documented by many years of research that caregiver involvement has positive outcomes for children. Because of this evidence base, we strongly encourage and recommend that caregivers be actively involved in their child's therapy sessions in order to see behavior change. Many insurance companies actually require documentation of caregiver involvement in the sessions in order to continue to authorize the services. For these reasons, therapists will collect data on caregiver involvement during sessions. These data will be graphed and reviewed with caregivers. Some examples of data collected include tracking the number of times a caregiver runs a specific program, tracking the length of time a parent is engaged in the session, and tracking the accuracy of implementation of a specific behavior change strategy. Caregiver participation is expected during 75% of the sessions. For example, if a child has a 2-hour session, we would expect the caregiver to be fully involved for 1.5 hours of the whole session. Participating in the session allows the caregiver opportunities to practice the strategies used in their child's programs. First, the therapist will model the strategy. Next, while the caregiver practices, they have the opportunity to receive immediate feedback from the therapist. The therapist will also work with the caregiver on their own specific caregiver goals during this time. Following the sessions, we expect that caregivers will continue to use the strategies and implement programs at home and in other settings without a therapist present. Providing these additional opportunities in the child's natural environments will help them reach their goals. In addition, using the strategies in different settings, such as the grocery store or park, will help the child learn to demonstrate the skill in all settings. Regular communication between caregivers and providers is necessary. Therapists will often check in with you at the beginning of each session to gather any updated information. Outside of sessions, therapists can be reached via email or phone. Important information to communicate with your therapist includes updates on your child's progress in their programs, any questions about the programs, any significant changes in your child's life, such as a new medication or a living arrangement. Additionally, it is important to always communicate about session cancellations and rescheduling. In sum, the ways that we expect caregivers to be involved in therapy at Lehigh University Autism Services is by participating in sessions and receiving therapist feedback, continuing to implement strategies at home, and regularly communicating with providers. Thank you for watching.